to talk about nasogastric tube insertion and removal. First, before I enter the room, I would check my physician's orders, make sure that I have the right patient, make note of the date of birth, and make sure I do in fact have an order to insert an NG tube, which I do. I'm going to gather my supplies. Good morning. My name is Nicole. I'll be your nurse today. How are you feeling? I'm washing my hands. Are you having any pain? Good. So the doctors ordered a nasogastric tube, and it's a tube that goes in your nose, through your throat, all the way down into your stomach, and we're going to connect it to suction to get some of that stuff out of your stomach, okay? It's not going to be pleasant, but I'm going to go as fast as possible. First, I'm going to sit you up a little bit and do a quick assessment. Can you tell me your full name and your date of birth? Good, and I know that matches with the name and date of birth that were on my orders. And verify your allergies for me. Great. If there was a pillow here, I'd remove it so he was able to hyperextend his neck. So I want to prepare my supplies first. And for my surface, I want to wipe this clean because I'm going to put my tape on this surface. So I'm going to wipe it clean and then prepare my tape. You're going to need 3 pieces of tape. You're going to need a short one, a long one, and one that's about medium length. And you're going to take the tape at the end and split it down the middle about halfway, just like that. There are fancy securing devices for NG tubes in some facilities, but tape always works and we always have it. This is my Salem sump tube. This is a tube commonly used for suctioning. It is not sterile. And you can see that the tube has this little pigtail. This is the vent for the tube. And this is an anti-reflux valve, which just means it doesn't let any gastric contents come out of this area right here. I can put this into warm water if I wanted to make it a little bit more flexible. All right, so I'm going to take a look at you. I'm going to look at your nostrils or your nares. Breathe in and out, in and out. All right, this right side looks good. I could also do an abdominal assessment, look, listen, and feel before if I need to. Very important, before you insert this tube, you need to measure it. So that's what we're going to do. And this is the next measurement. It's the nose to earlobe to xiphoid process. So we're going to take it from the nose to the earlobe, hold it there, pull it down to the xiphoid process. I'm going to mark that with my fingers, and I'm going to take my short piece of tape, or you can mark this with a Sharpie if it's a real life situation. And that way I know when I insert it, I don't want to go past that measurement. Okay, just grab my gloves. So Mr. Jones, what I want you to do is, first I'm going to have you look up, and I'm going to insert the tube, and when I tell you, I want you to look down, and I'm going to give you this jug of water, it's just a little bit of water, and when I tell you, I want you to look down and swallow, 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 and that's going to help the tube pass into your stomach, okay? Like I said, it's not going to be comfortable. If you feel like you're going to get sick or gag, you can use this, your emesis basin, and we're going to put a towel here just to try and keep as clean as possible. If at any point it becomes too much for you, I want you to clap your hands, but keep in mind we have to get it done. So try to bear with me and we can get through it all in one, okay? If at any point my patient was not able to, became short of breath, became cyanotic, or even was not able to speak or hum, I would know that I'm in the wrong place. I would remove the tube, give the patient a period of rest, and start over. So I've got it measured. I want to make sure my suction is working, and it is. Okay. Another really important piece of this is you want to make sure you lubricate the tube. Normally we would use a water-based lubricant, get it all over the tube. For the mannequin, we're going to use a special mannequin lubricant. Okay. All right, Mr. Jones, are you ready? Okay, so I want you to look up. Now look down and swallow, 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 swallow. Keep swallowing, keep swallowing. We're almost there. Keep swallowing. Now I will say on the mannequin, it will not go to the tape. These are mannequins, not real people. So in real life, I would go all the way to the tape. Because this is a mannequin, it won't go any further. So once I've got it in, are you feeling okay? You doing all right? I know that was uncomfortable. So we're gonna secure it now with that tape that you tore. You're going to put that down the bridge of the nose. And then these two pieces that you tore, you're going to wrap it around the tube all the way. And this is going to create a nice secure tube so it doesn't get pulled out. In addition to that, I also want to tape it to the gown. That's what my other piece of tape is for. So you want to have the patient look to the other side so you have that slack in the tube so you don't get it pulled out. So now that I've secured the tube, I'm going to send my patient off to x-ray or have x-ray come up and take an x-ray, a KUB of him, and that's going to show that the NG tube is in the correct place. X-ray is the gold standard. There are other ways you can verify placement, but X-ray is always the #1 gold standard for verifying placement. So I verified my placement. It is in the stomach where it's supposed to be. I can now go ahead and connect it to suction. So I want to make sure that this blue vent stays above the level of the stomach at all times. I'm going to turn my suction on to intermittent. And I'm going to connect the suction. And I'm going to keep, like I said, this up here above the level. And you can hear that the suction's working above the level of the stomach. Okay, at this point, I would put the patient all the way back down to the original position, give them the call light, tell them to call me with any shortness of breath, pain, any type of discomfort, and I would make sure that they have their call light within reach. For this purpose, I'm going to show you how to go ahead and remove the NG tube. So we're going to pretend that we have an order to remove an NG tube, and you would check that order before you come into the room. So I do have an order to remove the tube. I'm going to check my patient's name and date of birth again. Tell me your full name and date of birth, and verify your allergies. And I know that matches up with the order that I just looked at. So I've got an order, Mr. Jones, to take that tube out, and the patient's going to go, yay! So in order to remove that tube, it's a simple step process, and I'll tell you exactly what to do. So I'm going to leave this towel here, and I'm going to turn my suction off. Okay? And I can go ahead and disconnect my suction right here. And I can also remove the tape where it was taped to the gown. And I'm going to take about 20 mLs of air. And the reason we do that is because we want to make sure the tube is clear of any gastric secretions, because we don't want that flying everywhere. So I'm going to instill about 20 mLs of air, and then I'm going to clamp my tube off. Okay, Mr. Jones, when I tell you, I want you to take a deep breath and hold it, okay? Put the tape off of there. 1, 2, 3, hold your breath. Straight into the towel. This is going to go into the trash or the biohazard. Are you feeling okay? Okay, and I'm going to provide for any nasal care or mouth care right now. Make sure, see if he wants to brush his teeth, anything like that. If he's not in PO anymore, he can have some water. Feeling okay? All right, I'm going to go ahead and put you down to how you were. You want to lay flat again? Okay. Okay, Mr. Jones, here's your call light. I want you to call me if you feel any pain, discomfort, shortness of breath, anything like that, or if you need anything, okay? All right. I'm going to wash my hands and I'm done. Clean up my area and I'm finished.